So the first question was, according to you, in which kind of buildings is it relevant to set up a limit on CO2 level? Is it every kind of building? Is it only residential, not residential? What would you say, and maybe which kind of level would you require?
Yeah, I think I mean there are limits based on health. I mean if you breathe too much CO2, bad things will happen, but not at typical indoor concentrations. There are occupational limits, I think 5,000, 30,000, depending on the duration. I'm not sure we need limits, other than those. There are a lot of people proposing, I'll call them limits, guidance, and so on. And actually, Mark's going to talk about that, Mark Mendell, in just a couple minutes. Some of these limits are not very well explained or justified. And so, yeah, Mark has a better answer to that. So,
Okay, so I will move the question to Mark then.
sure.
But I hear that for you it's more 5,000 or 5,000 ppm.
Well, those aren't, those are based on, government organizations, people who set limits based on health and exposure.
Yeah.
I don't worry about 1,000 myself,
Okay, thank you very much. The second question is, we are currently developing advanced function materials such as metal organic frameworks that can directly capture the CO2 from the air. If we design an air cleaner capable of absorbing CO2 from indoor air, do you think it could significantly reduce the required ventilation rate and improve energy efficiency?
Yeah. Well, the X-ray position document, who cares what I think? The X-ray position document, states that if, air cleaning technology that removes only CO2 isn't necessarily going to, improve indoor air quality overall, because there's a whole bunch of other contaminants we care about. So I would be a little wary of reducing ventilation rates just if you're removing CO2. If your MOF system takes out VOCs and all sorts of other contaminants that are probably more harmful in most buildings, or more of a matter of concern, that'd be a different issue. But just removing CO2 from indoor air, I guess it's a good thing, but there's a lot more to indoor air quality than CO2, right?
So only removing CO2 would not help to reduce the required ventilation rate, most probably.
Yeah, I mean, that's basically what the X-ray position document says. It doesn't, improve overall indoor air quality, just that approach. You've got to look at all the contaminants that are, in the space and deal with those. And I think we all know in the indoor air quality field that controlling the source is step one, and then go to ventilation and air cleaning. It's, yeah.
Thank you. Thank you very much, Andy. I think we don't have other question yet, so we will move the floor to Bjarne Olesen for the second presentation. If you have some more questions to Andy, please ask them, and we will address them at the end of the webinar.